everybody. Happy Monday. Hope everybody had a great weekend. This is Dr. Karen Palmer. I'm actually broadcasting before I go into the office this morning. I am waiting for Dr. Shade Fari. There she is. Mary, good morning, everybody. Hi, Dr. Fari. Good morning. How are
Hi,
you?
good morning.
Thanks for joining
Oh,
me.
thank you for having me.
Yeah, we have a couple of viewers out there already. Thanks for coming on to talk a little bit about RSV season. I'm kind of interested to get your ideas of like what you're seeing on the East Coast as we're here out on the West Coast. But before we really dig in, I'm going to give you a chance to introduce yourself. I kind of put the headlines out there that you're a pediatric pulmonologist, but tell us a little bit more about yourself and what you do.
Sure, thank you. I'm Dr. Shade Farri. I'm a pediatric pulmonology. I'm the founder of Children's Lung Asthma and Pulmonary Specialist. We call that CLAPS. It's in Wayne, New Jersey, and it's a joy to bring help and care to children with breathing problems. So thank you for having me.
Oh my goodness, I can't think of a more perfect person to bring on to talk about RSV season. Hi, Wonder Kids has joined us this morning too. Hi, Dr. Bhattacharya. She's in Florida and she's a general pediatrician as well. So I was curious because over the Christmas break, actually, I was pretty busy taking care of a couple patients with RSV, and I thought, oh, here it comes. We've been bracing ourselves for it, and here it comes. I feel like these days there's a lot more discussion about RSV. I think probably with the advent of Nercevimab, and then also the vaccines for expectant moms, as well as for the elderly. So I'm just kind of curious, like, I guess we probably should talk a little bit about what RSV is,
Mhm.
who's at risk, and maybe you can fill in the details for us. Tell us a
Right.
little bit about
Sure.
RSV. Who's at risk?
Sure. RSV is a fancy, a short way we call respiratory syncytial virus. It's one of the commonest cold viruses that affects children. It affects adults as well, but children are at particular risk. All children, because of many reasons, their immune system is still developing. They are also, when they have respiratory infections, it affects their feeding, ability to sleep. We call them obligate nose breathers, people who depend only on their noses to breathe. So that RSV has always been a big deal. And over the past few years, we've had a number of what I call them mini epidemics where it's just really been. So, and who's at risk? So newborns, babies who are in the first 2 months of life are at particular risk. Children who have an underlying lung or heart disease are also at risk. Um,
Okay.
chil- um, and then children who have a problem, an underlying problem, clearing secretions, swallowing, are also at greater risk. And then in general, children who have weakened immune systems, so their ability to fight an infection, also at risk. So they're big groups, but I think those are some of the top ones that we work.
Yeah. And, for the longest time, we had Synagis, which or Pavliximab, which was really indicated for babies that were born prematurely. And I remember it was like moving mountains, and it was, I don't know, it was like trying to get through the Suez Canal. Like everything just had to be perfectly aligned. Prior authorizations done
Yeah.
with insurance companies, and then the patient had to come in once we received the vaccine, and like it had to be administered, and all of that. And so we were pretty excited about the advent of Nercevimab or Beyfortus being available to infants this RSV season. And I don't know about you, but I found it pretty disappointing that as soon as Sanofi was starting to ship out the higher dose, because it comes in two doses, 50 milligrams and 100 milligrams, that as soon as they started shipping out to their first orders, they said we can't commit to any more this season. So that was pretty disappointing. I had a lot of phone calls about that and a lot of conversations. And then pretty soon after that, the lower dose Nercevimab was also kind of in the same boat where they said we can't take any more prior orders. Did you find that to be like the case in your part of the country? Like how did that
I
go
know.
for your patients?
It was significantly, we got so many emails, coordinations about restricted doses, and then we started creating extra criteria. So you're right, for the longest time, we had something for the premature, the most at risk, and we had to jump through hoops to get that. And
Right.
now the idea that more children who, can have it, but then this first season, I'm not sure, I think they said they underestimated demand. So on the longer term, short term, not a good thing. Long term picture, I think for the pediatric population, it's actually good news that
Yeah.
season by season, we would have a lot of this
Yeah,
prevention.
I'm pretty excited about it too. We actually were lucky enough to get a few doses, and I probably shouldn't say this, but we still have a couple of doses, like low dose,
Oh, yeah.
which yeah, and I have a couple of expectant moms that are delivering this like right in the next couple of weeks. So I think we're covered there, and we've already been able to vaccinate a few children, and I mean so far so good. How efficacious do you think this vaccine is? I know we're just getting started in our RSV season, but what's the word out there?
The word out there is that it's very good. So because not to get too deep into the science of it, but it's an antibody.
Right.
So it gives the immunity right away, and so it's that's one of the things we've been finding. Now it's really early in the season. We're not seeing RSV as much as we have in the past,
Okay.
but fingers crossed that it remains that way. But like you said, that the fact that moms, also pregnant moms, have an option is also a good thing, because when that way we have the vaccine we have for the infants, but we can also give expectant moms some protection. So
Yeah, that's fantastic. That question actually came up last week. We had a mom that had already been vaccinated for RSV, and then the question was, did she need to actually vaccinate her baby? And so that was actually a really good question, because we were ready to vaccinate the baby, and then we did some reading and discovered that no, if moms have been vaccinated at least 2 weeks before delivery, the
yeah,
baby should be
yeah,
fine. Yeah, I'm really kind of worried about all these little babies that are being born in the next couple of weeks, because I kind of think if we're seeing it over Christmas, that we'll start to see a little bit more going
yeah.
around. One of the other questions that came up actually was a parent who called, whose child is in daycare, and said, "Oh my goodness, there's been a couple cases of RSV in the daycare. When do I worry?" And I said, well, the thing is, like, to hold your child out of daycare until the end of RSV season, which is probably going to go on for the next 6 to 8 weeks, logistically is like it's just not possible for working parents. But the question came up, and I was like, well, he's probably already been exposed to just observe for symptoms. But for parents out there whose children are with other children, like, what can they do to prevent the spread of RSV? And when do we worry?
Okay, yeah. So let me start with how can we prevent the prevention of RSV, the spread or the infection
Yes.
of RSV. So I think the one good hand hygiene is one that, and it's a struggle for children that age and in daycare, but for everyone, meaning, so they've come, if and when they're able to do that before they leave daycare, a little hand wash, right? And if not, as soon as they get into the home, everyone in the home, not just the child who went to daycare, siblings,
Yes.
parents who went out, right? Because we can all bring RSV home. As much as possible, we want to try to teach them to avoid, that's, again, these are things that depends on the child. So we probably can get success with the older child, but the infant, it will be one thing that we're conscious of. As much as possible, limit sick contact also within the home. The ones outside of the home, we may not have absolute control over. That's important. The other thing is, I think we underestimate the power of good nutrition and hydration as a prevention. Like you
Right.
mentioned, we get exposed to so many things every day. It's not every single virus that every time we get in contact with RSV that it tries to infect us. That's successful. So emphasizing that continuing to eat right, continue to drink well is important as a prevention for not getting sick with every virus you're exposed to. And then getting vaccinations for everything else is also important.
Oh,
Uh,
yes.
so even if you're not in that age group that's eligible for an RSV vaccine, but if you're vaccinated against the flu, if you're vaccinated against, your routine vaccines, your body has immunity against so many things. So that helps you when you have to deal with another virus. So starting from general principles, I think those are important. Minimizing kissing. I think pediatricians, you do a lot of education around that, kissing and hugging the baby.
Yes.
Uh, Someone is sick, not visiting. I think those are important.
Yeah, no, those are really good points. And I think when parents call in and they're really worried, it's hard to like come up with like like a magic solution. And I was like, well, I mean, he's already been exposed, and I mean, you could keep your child out of daycare, but they love it, and you need to work. And besides good hand washing and trying to prevent people who are sick from coming in contact with your child, there's not a whole lot more that you can do. I know that there's some parents out there who have newborns, and they're worried about their preschool child going to school and bringing something home. And so I'll usually say the same thing. In fact, I had one mom say, I think this really works. She doesn't really get sick very often because she literally like takes a bath when she comes home from school and changes out of her school clothing before she hangs out with her baby sister. And I feel like that does make a huge difference. And you're right, like getting vaccinated for the flu, I mean, you can still get a flu vaccine right now. And I know that you've seen this too, like babies and children infected with both RSV and flu at the same time. Imagine that. So very good points. So the question is, well, so if your child does have RSV and then does become pretty sick, like has trouble breathing or is wheezing and or has fever, like how do we go about managing this? I kind of know how I do it, but I'm just kind of curious, like what do you do?
Yes. So I think that let's start from some of the symptoms that we see. Fever tends to be a big one that children struggle with, and then nasal congestion, just being very congested. Now, for babies, that's a very big deal because sleeping, the ability to sleep and to eat, and so the restlessness, and then even before we then get to the trouble breathing, and then the lungs, and sometimes the wheezing. So from the point of easing nasal congestion, it's a big deal. A little nasal saline and gentle suction, emphasis on gentle. Right?
Yeah.
I know there's a lot of aids that people like, and so it's important because we're easing the burden. It makes it easier for them to feed. That brings me to the next point. Feeding should be probably less volume, but more frequent. So less volume, because sometimes the cough, it's very easy for them to throw up, and we don't want that can become a complication when it gets into the lungs, which we don't want. So less volume, and I know that's hard for parents. They want to feed the baby more. So even if it's breastfed or bottle, just less volume, less time, and then you can make it more frequent because they do need that extra hydration. The lungs, when they're sick, they lose a lot of fluid, so they need more fluid. It's just that a little volume, more frequent. The other thing that people ask about, and maybe we can talk about this some, is how about humidifiers?
Yes, that's a good question. Tackle it.
Helpful or helpful? I think it depends. So, I think it depends. There's definitely important things to be aware of in terms of humidifiers. The first thing is, so why humidifiers? Why does it come in place? Number one, that right now it's colder out, and so the air is drier. And the lungs like more humid air. So there's a reason. That's the reasoning behind trying to supplement humidification. But then the few things we have to know: dust mites and mold like more humid air. So especially for those children with allergies and asthma, making the home more humid or the room more humid over time may be posing a risk of promoting those things.
Okay. So does that mean, does that mean then a humidifier would be okay for short term, but not for everyday use during the winter?
Exactly, with a few caveats as well. They need to be cleaned often. Humidifiers can become, especially you have to be careful about the water, preferably purified or distilled water. Not because tap water and well water tends to contain a lot of bacteria, which you can then release into the air, which will cause more respiratory symptoms.
Bad news. Don't do that.
And then filters need to be cleaned as often as weekly, and right? So very frequently, and then cleaning the actual unit every 1 to 3 days. So, and then a few more things. Those chemicals that, the vapor rubs and essential oils that people like to add to the humidifier, the upper airway may be tolerant of it, but not the lower airways. Those become very irritable when they get into the lower part of the lungs. And so water is the only safe thing. So those are and then there are a few more, but those are the safe things. Is it cool or warm? definitely for young children, cool. There's no value. It's unsafe to use warmer or hotter air. So I think those are a few things to point out about the question: should we do humidifier? Is it helpful? Is it harmful? We have to be very careful. So
Wow.
we talked about suctioning, talked about whether humidification helps or it doesn't, and we've talked about hydration as well. It's part. I think it's part of it. And then pain and fever reduces based on the recommendation of your pediatrician, depending on the age of the child, right? Because the other thing, not just the fever, you had a cold and you know how sometimes your body aches. So now imagine that in a child who can express that.
Right.
So it aches, it hurts. So reducing the fever, but also reducing the pain and the inflammation. So
Mm-hmm.
I think those are the high points. And then talk to your pediatrician, please.
That is such amazing. And we have some of our viewers out there. It really is valuable information. I mean, I brought you on because I'm learning from you too, because I know what I tell my patients. And, you know, if they start a humidifier, I'm usually okay with it. And I usually do say, like, proceed with caution with things like, you know, those chest rubs and things like that, because the old school rubs, some of them actually had camphor, which can actually be toxic to young children. And so I usually don't recommend those. I think they've reformulated them to not include camphor, but still, like, some kids who are getting a little wheezy or get a little sicker with a cold might actually also be the same child that has very sensitive skin. And then now you're applying some kind of ointment or tincture to their skin with all sorts of ingredients in it that could actually set off their eczema and atopic dermatitis as well. So such valuable information. So what I do in the office as a pediatrician, and what I did over Christmas, you'd be surprised at how sick children can get with RSV. I mean, you know, but for our viewers out there and our listeners, sometimes they're really working very hard to breathe. And we're counting their breaths, and they're breathing 50 or 60 times a minute. And then we're checking their oxygen levels. You know, in the office, I'm able to run a test to verify that it truly is RSV. And I spend a lot of time educating parents on what to look for signs of worsening. Over Christmas, I had a couple of sick patients, and you know, the emergency rooms will bump them. You know, they'll evaluate them, test them, and then send them home. And so sometimes, like, the best care, because there isn't a treatment for RSV. Like, it's not like the flu where once you get it, like, you could actually take Tamiflu. With RSV, there isn't a treatment once you have it. It really just is supportive care.
Absolutely.
And for the pediatricians and parents, it's just close monitoring. And so there are times during RSV season where I literally am seeing the same child day after day after day. We're checking oxygen levels, we're checking hydration status, their breathing status, and kind of going, is today the day that we need to send you to the hospital, or do you come back and see me tomorrow? And so it can sometimes be very slow going, but you know, kids can come through it with that close follow-up.